The honourable member for Cloverdale, Langley City.
Great. Thank you, Mr. Speaker. Mr. Speaker, Bill C-3 will protect healthcare workers, Canadians seeking health services, and Canadians who work in federally regulated sectors, deciding between their well-being and paying bills. Delivering protections for healthcare workers and 10 days paid sick leave were top priorities for our government. It is why I stand here today, just weeks into the 44th Parliament, speaking in favour of Bill C-3, so we can ensure Canadians receive the protections they deserve as quickly as possible. Throughout this pandemic, Madam Speaker, we've commended our healthcare workers through efforts such as the nightly banging of pots and honking.
Can we have some order in the House, please? There's a member doing a speech. Order!
As I was saying, we've commended our healthcare workers through efforts such as the nightly banging of pots and honking of horns at 7 p.m. Healthcare workers have been true heroes, working on the front lines tirelessly. Calling healthcare workers heroes and commending their bravery, while entirely deserved, is not enough. We need to provide real protections to them. The amendments to the criminal code in this bill will afford healthcare workers security against obstructions from accessing their workplaces safely. Unfortunately, we've seen terrible incidents where doctors and nurses and other healthcare practitioners have been intimidated, threatened, and in some cases spit on or otherwise threatened with violence, all because they're saving the lives of COVID-19 patients. Madam Speaker, I'd like to take a moment to give you my very personal perspective on this bill. My wife is a doctor at a hospital that was declared a COVID hospital at the outset of the pandemic. During the first week of the pandemic, we updated our wills, not knowing what dangers we faced. We slept on different floors and took extra precautions to sanitize when we could actually find disinfectant materials. Some doctors moved out of their private homes to protect their families and moved into private accommodations. Many extra precautions were taken to launder clothes to make sure the viruses did not come into our personal homes. Challenges continued, wave after wave. Then throw in a heat dome and another wave, and we have a healthcare crisis and a system that is stretched to the breaking point, relying on the goodwill and moral fiber of the people who work in the system. I'd like to thank my wife and her hospitalist colleagues at Surrey Memorial Hospital and other hospitals across the country, the specialists and technicians, the nurses and the aides, the cleaning staff and the food services, and everyone else in patient care, all who worked to keep the rest of us safe. And now protesters are trying to threaten these workers from accessing their places of work and to prevent them from accessing their places of work. I feel especially for the emergency room doctors, but and also the paramedics who are understaffed, underfunded, and need to shepherd their patients past rabid anti-vaxxer protesters. Our healthcare workers are facing moral distress, Madam Speaker. And no one should feel unsafe at their workplace. And this legislation will provide healthcare workers the confidence and legal protections that are needed to safely access their workplaces. We know that intimidation can manifest itself through online forums as well, not just in person. We're protecting healthcare workers here as well. In the age of social media and digital technology, we know that online threats can be just as real and devastating as those faced in front of a workplace. No individual should be able to use fear to stop a healthcare worker or those who assist them from performing their duties. Our legislation will not only protect healthcare workers, but those accessing healthcare as well. In many cases, those accessing healthcare are the most vulnerable, particularly during this pandemic. This summer, an individual went to Toronto from Prince Edward Island to wait for a lung transplant. They were leaving their hospital after a physiotherapy session. They had to be escorted by police to protect them from an unmasked group blocking access to and from the hospital. And we've heard story after story of this kind of behavior across the country. We cannot accept this behavior, Madam Speaker, which is placing our most vulnerable at risk. This legislation clearly ensures Canadians have the freedom to voice their concerns and protest in a safe and peaceful manner. It also ensures workers' freedom to take labour action, including picketing. These will be respected by these proposed changes to Canada's criminal law. The COVID-19 pandemic has highlighted a number of issues facing Canadians in their workplaces. Too many healthcare workers those who assist them, and Canadians seeking medical attention or medical care have experienced or feared intimidation while attempting to provide or access health services. In normal times, this type of harassment and intimidation is disagreeable. But during a worldwide pandemic, Madam Speaker, this type of behavior is abhorrent, and this is why legislation is needed. I'll now shift my focus to another aspect of this bill. Too many Canadians have been forced to choose between staying home when they are sick or being able to afford rent or groceries. This legislation's other change, which is the provision of 10 days of paid sick leave, will protect the well-being of Canadians, support them economically, and avoid pressures on our healthcare system. While this only applies to federally regulated workers, numbering almost 1 million workers at this point, it will contribute to a wider discussion about paid sick leave across the country. Madam Speaker, the pandemic has demonstrated the effect that illness can have on our economy and the cost for individuals and families. With isolations and quarantines lasting up to 2 weeks, workers need to know if they contract COVID-19, they can take the necessary time off work without risking losses to their income and without exposing others to the risks of COVID. Not only will this ensure workers do not need to choose between their income and their well-being, but this will also avoid spreading COVID-19 or other contagious illnesses in the workplace. There have been too many stories of outbreaks in workplaces that happened because individuals felt they had to come into work because they could not afford to take unpaid time off. This often results in negative economic effects for companies as well. Not only will this legislation help workers, but it will be a preventive measure for our healthcare system. We have all experienced lockdowns throughout the last 20 months to avoid our hospitals from being overwhelmed by COVID-19 cases. This is another measure to prevent outbreaks at workplaces from driving up case numbers, putting our healthcare system at risk now and in the future. For Canadians not employed in a federally regulated industry, our government will be engaging in consultations with federally regulated employers and workers towards the implementation of this legislation. Additionally, the government will convene provinces, territories, and other interested stakeholders to develop a national action plan to legislate paid sick leave across the country while respecting provincial and territorial jurisdiction and clearly recognizing the unique needs of small business owners. 10 days paid sick leave is another tool in creating a more resilient economy as we emerge from the COVID-19 pandemic. Madam Speaker, for all of the reasons that I've outlined in my speech today, I will be supporting this bill, and I will welcome any questions from my colleagues.